Hi students. Today I'm going to discuss about called as the National Mental Health Program. So what is this National Mental Health Program? It is otherwise called as NMHP. The government of India launched this particular program, National Mental Health Program, in the year 1982, keeping in view the heavy burden of mental illness, how mentally ill patients were treated. So, keeping in view of the mental illness, the incidence of mental illness, it can be, or the treatment of mentally ill clients, and the society, the attitude of the society towards the mentally ill clients. So, keeping in view of that, the National Mental Health Program was launched in the year 1982. There was absolutely inadequacy of the mental health care infrastructure in the country to deal with the mental illness. So the main reason why the National Mental Health Program was launched was because of the incidence of the mental illness as well as the inadequacy of treatment services to the mentally ill individual. Okay, so that is brief concept of National Mental Health Program. So moving on to the aims of the National Mental Health Program. So what are the aims of National Mental Health Program? Prevention and treatment of mental and neurological disorders and their associated disabilities. So the main aim was to treat the mental disorders, associated neurological disorders, and because of this mental and neurological disorders, there can be associated disabilities. To treat that, this particular program was launched. Use of mental health technology to improve general health services. So as there are advances, as there is advancement in the medical field, even the mental health technology as a whole, it should bring about the general health improvement in the client. Okay, that is the second aim of the program. Application of mental health principles in total national development to improve the quality of life. So we have to have certain principles when we care for a mentally ill client. So the application of these principles that the health team should use to bring about the overall improvement in the life of a person. So these are the aims of the National Mental Health Program. Moving to the objectives of the National Mental Health Program: to ensure availability and accessibility of minimum mental health care for all the foreseeable future, particularly the most vulnerable and underprivileged sections of the population. So the underprivileged and the most vulnerable group of population, if you take, can be the poverty or people who are staying in the rural areas, or people who are at risk of developing the mental illness. It can be the geriatric group or a child or adolescent group. So a family in which the dynamics or relationship is not maintained, such a group should be able to access the mental health service, and the availability of the mental health services to such population should be delivered. So that is the first objective of the National Mental Health Program. The second one is to encourage application of mental health knowledge in general health care and the social development. So, if the population or if the community is having the knowledge related to mental illness or the mental health, it will be helping the community to develop or to improve the overall general health as well as the general health. Obviously, even the social development will happen. So, to see to it that the mental health as well as the physical or the general health of a person to be improved, which will give way to the development of the society. The next one is to promote community participation in the mental health services development and to stimulate effort towards self-help in the community. The goal of this objective is, like, during the earlier ages, the community were not supporting the mentally ill individuals. It's very important that even the community will support the mentally ill individuals to cope up with the condition. So the promotion of the community participation to help the mentally ill individual is very important. So the next one is the strategies of the National Mental Health Program. What are the strategies? The first is integration of mental health with the primary health care through the NMHP. The strategy was to integrate the mental health with the primary health care. Each and every population should get an access to the mental health services. So even in the community mental health service, health care, the mental health care should also be included. That is the first strategy of the NMHP. The second is provision of tertiary care institutions for treatment of mental disorders. So tertiary care institutions should also include the treatment option for the mentally ill individuals. So third one is eradicating stigmatization of mentally ill patients and protecting the rights through the regulatory bodies or the institutions like the Central Mental Health Authority and the State Mental Health Authority, since there was a lot of stigma related to the mental illness. So the myths about or misconceptions of mental illness. So a lot of stigma was there in the community. To eradicate that stigma, to make sure that the people who are suffering with the mental illness are given an opportunity or are given a place in the society, the NMHP program was launched, and also it was integrated with the central as well as the state authorities which will regulate these services. These are the strategies of the NMHP. What are the approaches of National Mental Health Program? Integration of mental health care services with the existing health services. So when we take the health, okay, it includes not only the physical health but also the emotional or the mental health, right? Was able to enlighten this knowledge regarding the integration of the mental health with the physical healthcare services, right? Utilization of the existing infrastructure of health services and also deliver the minimum mental health care. Government also emphasized the utilization of the existing infrastructures or the hospitals for giving the services for the mentally ill individual. Even the minimum, at least the minimum care that what has to be delivered to a mentally ill patient should be given in any kind of a health center. So that was another approach of the National Mental Health Program. The next thing is provision of appropriate task orientation training to the existing health staff. So even the health staffs or the health workers, if you take in the community centers or the primary health centers, even the staffs who are there, they have to be trained how to deal with the mentally ill clients. The orientation training also should be given to the health workers or the staff members who are working in the community health centers. Next is linkage of mental health services with the existing community development programs. So there are many community development programs, as you know. So even the program which is related to the mental health also should be integrated or should be a part of the community health program. So moving on to the components. So if you take the components of National Mental Health Program, we have got three components. One is the treatment at various levels. Second is the rehabilitation and the Third one is the prevention of the mental disorders. So you're going to learn about each of the component in detail. So if you take the first one, which is treatment at various or multiple levels, so you're going to see what are the treatment options at the different levels in a community centers, right? First, in you can we have different levels like at village level or sub-center level. Then we have at the primary healthcare center level or district level. So at the different level of the care, what are the responsibilities which are initiated related to the mental health services? Village and the sub-center level, multi-purpose health workers or the health supervisors under the supervision of the medical officer, they are to be trained for certain things. The healthcare, multi-purpose healthcare workers as well as the health supervisors should be trained by the medical officer, whoever is in charge of the village or the sub-center. They are to be trained for certain responsibilities. So what are those? Management of psychiatric emergencies. So each and every health worker or the health supervisor should have the knowledge related to management of the psychiatric emergencies, administration and supervision of maintenance treatment of chronic psychiatric disorders, treating the mentally ill clients who are suffering with the chronic disorders. So that is another responsibility that they have to know. Third one is to diagnose and manage the grand mal seizure, especially in case of the children. Liaison with local school teachers and parents regarding the mental retardation and behavioral problems in the children. So school is a place where children spend most of their time. So the school teachers as well as the parents, the health workers or the health supervisors should coordinate with the school teachers, local school teachers as well as parents to identify any kind of children who are suffering with the mental retardation or who are suffering with any kind of the behavioral disorders, okay, to be communicated to these health workers. Counseling problems related to alcohol and drug abuse. So they are also supposed to have a knowledge regarding the counseling. So how these counseling will help to bring about a change in people who are having this problems such as substance abuse or any kind of the alcohol abuse disorders. The next level of care is in the primary health center. So the medical officer of the primary health center, aided by the health supervisors, to be trained for certain things. One is supervision of multipurpose workers' performance. So the health supervisor should be able to supervise the work of the multipurpose worker, how they are performing their duties. Second thing is elementary diagnosis, the primary diagnosis that they can make, treatment of functional psychosis. So what is the treatment of psychotic disorder? So such kind of a treatment option or prescribing medications can be given by the medical officer. Next is treatment of uncomplicated cases of psychiatric disorders associated with a physical disease. So because of there are conditions which concurrently occur. So the mental disorders as well as the physical disorders, when it concurrently occurs, so such kind of a disorders also can be treated by the medical officer. Management of uncomplicated psychosocial problems of the clients and epidemiological surveillance of mental morbidity. So periodic statistics of the cases of mental disorders to be identified and should be reported. So epidemiological surveillance should be done to find out the number of mental disorders. Right. So the next level is at the district hospital. So if you take the district hospital, it recognizes that there should be at least one psychiatrist attached to every district hospital as an integral part of district health services. If you take any district health center, there should be at least one psychiatrist available to meet the client's needs. Right, so the district hospital should have at least 30 to 50 psychiatric beds. So in a district hospital, it is mandatory that the hospital has the capacity of 30 to 50 beds, which is allotted only for the psychiatric department. The psychiatrist in the district hospital should devote only a part of time in clinical care and a greater part in training and supervision of the specialist health workers. So, what is the responsibility of the psychiatrist who is there in a district hospital? So, a part of time that he can spend for consulting the clients with the mental disorder, and most of the time that he is having the role to train and supervise the health workers in the particular department. So, this is the responsibilities or the principles that the healthcare workers should follow at the district hospital. Next is mental hospitals and teaching psychiatric units. So if you take the mental hospitals and the teaching psychiatric units, what are the responsibilities that they have to carry out? Major activities of these higher centers of the psychiatric care, it includes the help in care of difficult cases. Okay, so the clients who are suffering with the mental disorders, right, so which is difficult to be treated. It can be the severe mental disorders, severe mania or severe depression or severe psychosis, or the complicated cases. So in such kind of cases will be given the care in the mental hospitals or the teaching psychiatric units. So the second thing is the teaching. So teaching or education will be given, psychoeducation will be given to the clients as well as to the relatives, right? So third one is specialized facilities like occupation therapy, units, psychotherapy, counseling and behavioral therapy. So even the therapies will be carried out, psychotherapies will be carried out in such mental hospitals. Can be any kind of the psychotherapy which will be carried out in the mental hospitals. That is about the treatment at multiple levels. So you have learned about treatment in the sub-center level or at the village level, who is the person who is responsible, and in the primary health center level, right? Then at the district hospital level as well as the mental health centers or the mental hospitals. So this is the first component. So moving on to the second component, which is the rehabilitation, right? Rehabilitation, what happens in this? Treatment of epileptics and psychotics at the community level and development of rehabilitation centers at both the district level and the higher referral centers. So they will be treating the epileptic cases, right? People who are suffering with the epileptic disorders, psychotic conditions, they all will be treated in the community setup, and also rehabilitation services will be given to such clients at both the district level and the higher referral center. So that is the rehabilitation component. The third one, the last component of the National Mental Health Program, is a prevention. So when it comes to prevention, it is nothing but the community-based preventive measures with the initial focus on prevention and control of the alcohol-related problems in a community where there are people with the alcohol dependent syndrome. So such cases will be identified and they will be given the education about the preventive aspect. So the community will be recognized and they will be given the education related to prevention of the abuse of alcohol. Right. Later on, the problems like addictions, juvenile delinquency, and acute adjustment problems like suicide attempts are to be addressed. So even these problems which are related to the juvenile delinquencies or any kind of addiction, right? Acute adjustment problems, suicidal ideas, all these can be prevented, right? So the preventive services related to these things can be given to the community, the education can be given, the awareness programs can be conducted. So that is how the preventive component of National Mental Health Program works. So this is the overall view of a national mental health program if you take. So the main aim, what is the aim, the objective strategies, the components at various levels we have, the rehabilitative services and the preventive measures of the mental health. Hope you all have understood the topic. Thank you.